erectile dysfunction. You'll see here in this first slide, and I like to not read slides, by the way. If people get to know me doing these presentations, that's not my style. I like to keep the information up there for you to see, because when you read those numbers, we can all see them. It speaks volumes. I think it speaks volumes to the problem that we have, that men share, that it's a lot more common than what we know. Certainly the first line of this slide is really defining what it is. And I think a lot of people think erectile dysfunction is only the floppy noodle kind of thing. But I can tell you, even today, this came up several times in my office about not being able to do what you want to do with it. That's what true ED is. So if it's a difficult time getting it hard enough for penetration, if it's difficult to maintain it at a hard enough rigidity for penetration, or if it is really just the floppy noodle kind of thing, that's all within the definition of erectile dysfunction. And when you put that kind of blanket statement on it, you see how tens of millions of Americans are suffering. And I'll be honest with you, I'll bet you a lot more than what we know. The process of erections, I think, is important, because we're going to talk about what causes ED. So understanding what we do to get an erection is important. The picture you'll see on the left here, and I don't know if you can see my arrow projecting it, but that picture there is the penis in the flaccid or soft state. If you can imagine the penis is like two cylindrical sponges, dish sponges, that are wrapped around, have a cellophane or saran wrapper around them, what winds up happening is that blood flows into those sponges. The sponges engorge and they start tightening up that saran wrap layer. Inside that layer are these little small veins that are responsible for normally draining out the blood. Well, when it's nice and tight, those veins shut down, our blood is trapped, we get an erection. And when the act is done, the process reverses itself. So that's why when we talk about the causes of ED, you may hear things like, oh, my buddy had prostate cancer surgery. Well, that's what his troubles were. Well, when you really look at it, the vast majority of patients have medical problems that a lot of us will develop over time. Whether it's diabetes, high blood pressure, peripheral vascular disease, coronary artery disease, or things related to poor blood flow. You actually look at those folks, and by the way, if you look at that wedge there, the medications we use to treat those problems are big causes of erectile dysfunction. In fact, the least amount of cause are the things that I do to patients, like prostate surgery. I'll get this question a lot, and this is where I partner a tremendous amount with Greg, because we have patients that we treat for both issues, testosterone and ED. And if you look, I'll get the question of, hey, do you think ED is the cause, is the cause of my ED related to testosterone issues? And the short answer is there's not a direct link. It's not like you low T and all of a sudden we can't get erections. But what it does mean is that interest, energy levels, your desires, all the things that go into the vim and vigor of life gets impacted. And as a result, our erections can get impacted as well. And as you see, these things can happen more commonly as we age, and we're getting our 40s and 50s, these things will come about. Just to pick my partner's brain here for a minute, Greg, I don't know if you've seen some guys who come to you maybe the low testosterone questions, and they'll come get, supplements or the kind of boosting agents or even some replacement agents, talk about the ED. I'm sure you see that a good amount as well. Is that correct?
Oh yeah. And guys will present everything from the very modest issues where, again, the erectile function just isn't what it was. And a lot of them will immediately default to, oh, it's my testosterone. And, one of the things is, I always tell them, the testosterone is the want to. It's really not the can do. Now, there is some influence in it. We know that there's, with increased testosterone, you can get increases in nitric oxide level, which, that's a huge benefit for blood flow. But correcting testosterone levels in and of itself is not really the treatment for ED. So it's the communication and the education on that side that's beneficial.
Yeah. And I'll tell you, I call it the canary in the coal mine a little bit too. So when, your erectile health is important, knowing you know, we kind of joke and laugh about it sometimes, and you'll see the commercials and people kind of, you know, pick on it. But, you know, our ability to achieve erections really is somewhat of a reflection of our overall health. In fact, you know, looking through some of these signs, for example, of low testosterone, you see that, well, some of these things can be related to an overall decline in our kind of general health care to begin with. So it's important that when you guys come in and they say, hey, doc, you know, I'm coming in from a low testosterone, you know what, I'll ask them about their erections. And if they come in with erectile dysfunction, I'll ask them about their testosterone and some other questions as well. So when you guys are kind of watching this seminar here and you're looking at those lists of things, you know, kind of cross-reference your symptoms with some on that list with some of the things we're dealing with, whether it's ED or low T, and you can kind of see where there are some connections.
And just to piggyback off of that, you know, one of the things that we always try to emphasize with guys when they come in and they're starting to have issues with erectile dysfunction, now there's a lot of correlations with heart health. So, you know, we always tell them if you're having significant issues with ED, now it's time to get yourself checked out all over.
Yeah, there's actually, yeah, I'm glad you brought that up. There was a few years ago, kind of a crummy study done at the VA that was essentially the equivalent of saying, well, gee, everybody who gets lung cancer has drank water before. It must be the water that causes it. And they looked at cardiovascular death and testosterone replacement. They said, oh, well, the guys who all had heart attacks and died from them, they all were on testosterone. Well, okay, but they also were maybe overweight and smokers or all the other risk factors. So they went back in that same cohort of patients and they said, okay, what if we control for all the other troubles that can cause heart disease? And then we looked at men who just had low T. They actually found that testosterone replacement was protective of their heart health, because men who have low testosterone eventually will develop cardiovascular disease. So these are important things. You know, again, the penis is the canary in the coal mine, and so is your testosterone levels to some degree. So you have the troubles, go get checked. Greg can kind of opine on this more than I would have on the different therapies we have. There's gels, injections, there's some medications that we can do with, you know, supplements and all the rest. Greg, if you want to kind of, you know, take a few minutes to go over some of the things that you guys offer.
So, you know, one thing most people are familiar with, there's treatments where you're using an injectable testosterone, which has been around for a long time, and it's effective. The problem with that is when we first started doing it, we were giving guys injections once a month, which basically meant that for the first week they felt pretty good, and for the rest of the month they didn't, because they would have a huge peak and then this gigantic trough. We started doing every couple of weeks, better, but still, you still get these highs and lows, and they can cause other issues, blood abnormalities and whatnot. So a lot of guys still like injections, but there's other ways of doing it. And we use a lot of compounded topical testosterone. And the nice thing about the topicals, you're applying it every day, which means that your levels are going to stay fairly consistent. And the nice thing that we can do in terms of compounding pharmacy is that we can make things very concentrated. One of the big caveats with the trade products is you're typically applying a large volume. And when you're doing this, you're causing other issues because you're increasing the chance of transference to a spouse or to your children's. When you're using a half of a milliliter or a quarter of a milliliter, it's very easy to use these. So they're very popular. Oral medications, supplements, certainly. There can be some sublingual testosterone products that are pretty effective. Generally speaking, taking a oral, like a tablet or a capsule version of testosterone, it's not effective. It gets chewed up in the digestive process and through first pass, so really that's not a great way. There's also pellets, which again, this is a implanted long-acting testosterone that's absorbed over several months period of time. The negative there is it's a procedure. It's an office procedure where there's an incision, there's the implanting of the pellets, and there's some cost factors involved with that are a lot different. So, we get a lot of questions. In fact, I had a question today, and just to kind of broaden this a little bit, I had a physician's office call me today, and they had a patient fairly young guy, 36 years old, very, very low testosterone. He'd been on a trade product for a couple of years, completely sub-therapeutic at this point, and they wanted to know how they can boost him up. And just to cover all of our bases here, you know, when I hear any story about a 36-year-old guy who's going to go on exogenous testosterone, I want to know, is he looking to have more kids? Are we going to cause a fertility issue for a patient? And if that's the case, there's other ways that we can go about things. But, you know, you want to have the whole picture, and, you know, you start asking questions like, well, you know, what's his energy? What's his drive? How's he feel? In addition to just what the numbers are, because, you know, treating just by numbers, it can be deceptive. You really have to see how a patient is feeling. Your goal is to make them feel good. So again, there's a lot of different products. There's a lot of ways of going about this. And again, it's a great option to have a menu of selections to choose from when you're dealing with these things.
Yeah, yeah. Well, I appreciate that. And that's why, you know, I've told you this before, I use you exclusively because I believe in what you're able to, I believe in your products that you guys make. I believe in your passion for taking care of your patients, and I trust in our partnership, which is very unique. I don't think I've used other compounding pharmacies for years, but I don't have the relationship now that I have with you that I had with them. I don't have that. Those guys in the past were here and there and didn't give me the kind of things I needed to take care of my patients. And really, truly, it's not a matter of me. And I've told you this before, Greg, in person, and I'm saying it in front of everybody who's watching, that it's a unique relationship, and I like it because you and I can text each other and bounce ideas off each other on a patient to get them what they most need. And when you're talking about the things we're talking about, including how to fix erections, you need, the more people you have on your team helping you, the better. And the ones that are more motivated to help you, the better. So I appreciate that. We'll segue into the erection treatments, because I'll tell you, if you look at this list here, I'm going to be the one that does the one right in the middle, okay, which is the penile implant. That's my direct relationship with my patients. You are handling all the things on either side. While I still prescribe them, these are the things that I'm calling you saying, Greg, I need to help with this guy with his pills. He needs to be put on a trachea or some other option, or, you know, his injections need to be upped, or even I need you to give me a good recommendation of vacuum erection device and all the rest. So let's walk through these slides, and I'll go through the general kind of gist of the meds, and then Greg, I want you to opine on what you guys offer, because I think that
Absolutely.
I think you guys have, I prefer your products, to be honest with you, and again, to kind of promote not just Stanley, but I think compounding pharmacies. What I like about working with you all is that I can get the same drugs, but they can be, you know, somewhat tailored to what the patients need. So the first set, which everybody knows, the oral medications, the Viagra, Levitra, Stendra, and Cialis. Those are the 4 commonly prescribed name brand drugs. 2 of the 4 are absolutely generic, the Viagra and the Cialis. Levitra is a tough to come by drug. I like the molecule itself, I think it works pretty well. Stendra was a last to market drug that's still pretty expensive and hard to come by. The pills work. They're pretty effective. They're certainly more effective than some of the other options. You know, we do know that in some folks are at higher risk of them failing than others. And that failing can be for a number of reasons. It could be because they just don't work, or, you know, occasionally we get guys who just have miserable side effects and just can't tolerate it, or finally, because they have other medications that they're not allowed to take it on. So while that's a kind of a go-to thing, and maybe tailoring a treatment protocol for a patient is important, that's one option. Greg, what are your thoughts on the pills and such?
So, you know, I think that one of the great things is there's a lot of choices. These medications, they're very specific. They're called PDE5 inhibitors, and they basically work by increasing the nitric oxide load, increasing blood flow by doing so. So a lot of what we do and Doc, you're aware of this, we do with all your patients, we run tests, we do nitric oxide assays for these guys to see what their levels are. Because if you're taking a medication that is reliant on having a healthy nitric oxide load and you're completely deficient, then you're kind of handicapping that medication. The tablets in general, so of course Viagra's been around the longest, and to this day, as long as it's been out there, the number one thing that I still hear from guys, nobody ever told them to take it on an empty stomach.
Yeah.
So, you know, Viagra is one, sildenafil, it is extremely sensitive to stomach content. So if you have food in your stomach, it's going to basically be ineffective. It's going to impair the absorption. The other thing about the tablets, even if you don't have food in your stomach, under the best case scenarios, they're still going through first pass metabolism, which means they got to go through your gut and your intestines and your liver, and then they get to your bloodstream. Well, problem is, by the time they get to the bloodstream, number one, it's probably an hour or longer. And secondly, you've probably lost a third of the medication before it's actually in your bloodstream where it's effective. So there are some problems with those. They're just not as effective as they could be. When we'll use the PDE5s, we do use tablets for some things, but generally we'll use what's called a troche. And a troche is a sublingual version of this, means it dissolves under your tongue. So why is that better? Because it bypasses the stomach. It doesn't go through this first pass metabolism. It's absorbed directly through the oral mucosa and gets to the bloodstream. So instead of something taking an hour or more to get into the bloodstream to be effective, we're talking 15 to 20 minutes. And that means that it doesn't have any bearing on whether you have food in your stomach. So, you know, if you're going out to dinner with your partner and on the drive home, you get a little wink, wink, nod, nod. Well, pop a Viagra and it's too late, but using a sublingual, it works better. So as far as the orals are concerned, yeah, there's definitely a place for them. We use a lot, especially with the daily dose. We love using the daily dose tadalafils just because it stays in the system for so long. It really maintains good, healthy blood flow. And then we can use that as a springboard for other treatments if necessary.
Yeah.
But you know, that's my opinion as far as the PDE5s is concerned.
Yeah, and I'll tell you, you know this, how many guys have we put on the daily and said, hey, listen, let's get a breakthrough, a little bit extra here and there to really boost your response. And I think it works fantastically. I really, truly can tell you, I've had men who on individual agents can't report as good results as when they're doing that combo. Yep. So I've really bought into that, and you get and really it helps those guys feel more secure with things. They feel more confident, and that also builds on that as well. Because remember, there's a little bit of the confidence issue that gets there. If you're going to take your Viagra and you're not sure it's going to work, that's even worse. So I like it. I like it more than some of the other options that I'm going to present. The options that I do present that are here are the other accepted things that we know we need to do. And some men are interested in, for example, the vacuum device. To me, as a primary treatment, I have mixed emotions because I think it's if you're not having sex on a very regular basis, I think it might be a reasonable option. But oftentimes, guys will find it cumbersome and uncomfortable. Certainly, where I really like using it is what I call in rehab protocols. And Greg, we've talked about this. In fact, we've talked about having fixed rehab protocols for our cancer patients, which is get the blood flow back there. Use it more as a device to exercise and bring the blood flow into the penis, stretch things out. In fact, even in some men, if done properly, can even regain some of the length they lost from from a prostate surgery, for example. That I see as a really good position for this treatment option, more so than a primary treatment. But the vacuum pump is a great option, Greg. I don't know what's your
yeah. So the great thing about the pump, and again, rehab, physical therapy, whatever you want to call it, when we work with guys, and really there's kind of two different categories: guys who've gone through a prostatectomy, where we basically go through this protocol where we initiate the daily dose PDE5 to get the blood flow going and make sure that the nitric oxide is good. Then we get them on a regimen where they're using a vacuum pump a couple of times a day, which again, we're helping to force the blood in. We're helping to, reinstate the erection so that they can actually experience that. And we get really, really good results with this. We have actually seen guys where they'll get restoration of some natural function just from doing this. And then we use this as a stepping stone. But in general, you know, of course, we still have guys that come in and they want to use a VED as their primary treatment for ED. And the great thing about pumps is they work.
Yeah.
The negative thing is they don't give you really a great quality erection. They're cumbersome. You have kind of an uncomfortable ring that you have to use with them to maintain the erection. And you know, in most statistics, what you'll see is, hey, the things will work in up to 85% of guys,
Yeah.
but over the course of a very short period of time, the vast majority of them will discontinue use of it, and
Yeah.
they'll look for a different treatment.
Yeah.
It's not enjoyable, and again, it serves a great purpose. I love them. I recommend them to a lot of our guys, a lot of your guys, simply because they serve a great purpose. But for primary treatment, not so much.
Yeah, and I'll tell you that you keyed in on something about the blood flow, because as we get to the surgical part of things, and you know, and I realize some people, ooh, surgery, but when we get into different treatment options, the blood flow, if we can continue getting blood into that tissue, it keeps it healthy and viable. Even if it's not, you know, even if these things aren't going to be your long-term treatment option, I can tell you, I can tell the difference. When I do an operation on the man who's had no blood flow there for a long time, I'll make an incision in the penis and I get no blood back. And I know that their problem's been there forever. It's amazing the difference between that type of operation and, let's say, someone who's had their prostate removed and their nerves don't allow them to get the function they need. I cut into that tissue and there's blood. So getting blood into that area is so important. I can't overemphasize it. So if it is doing something like this, do it. If it's definitely, I love the combination of the medications, the pills and the pumps. I think it's an important thing. I made mention of the things I don't like, and this is the one thing I don't like. You smiled at it, you get it too. I think in 1985, maybe even 1995, before the pills were available, and this was the kind of workaround for shots, and it worked. I can tell you, in 10 years of private practice urology and 5 years of training, I've written probably less than 10 prescriptions for this, and 100% of those have been refills. I've never treated a man with this medication as a primary therapy because I got so many better options. Yeah. So I'll leave it at that, because I think this is the better option. And men who, you know, if you're there, you're exploring your options, and meds aren't working to your satisfaction, you're not quite sure about surgery quite yet, what else is there? To me, if I'm sticking anything anywhere, I'm sticking a needle in my penis. I know that sounds scary. Greg will attest to this because we see patients all the time on this, which is, it's not as bad as you think. You know, there's ways around it. It's not so terrible. Medications go into the penis. Here on the slide, this is kind of a, you know, these are the industry produced slides. We can't kind of work our way around those name brand drugs, but this is where Greg and I's partnership is lock and step, is in the injections as well. Because the most commonly prescribed thing in my practice is Trimix, 2 meds that give us an erection and 1 medication that essentially doesn't allow it to go away. Those 3 medications are very effective in treating men. Greg and I oftentimes will chit chat about, well, maybe I need to, what do you think about increasing this or decreasing that, and finding the right formulation for men. The shots really do work quite well. You know, the disadvantage of the shots is it's not 100% for everybody, and it's not 100% effective. There's some patients who have to move beyond that, but if they do work, they are a good option. You see some of the side effects that are there. There are some side effects that we can work to our way around avoiding some of these, especially that one where the priapism or prolonged erection. I think those are things we can collaborate between the two of us to make sure our patients don't have those issues. But I will tell you that shots are kind of my next go-to thing. So if the pills aren't working and we've tried our different formulations, then I would usually go to shots. Greg, you take it over. What do you think?
Yeah, so the biggest thing about this, yeah, everybody's afraid when you say you're going to stick a needle in your penis. To be honest, within about 2 tries, guys have adjusted to that idea. The great thing about this is these are so customizable. If a guy has decent blood flow, we're going to get him a response. And, that's the great thing. And we can really affect duration. We can affect firmness. And, one of the most common questions that I get from guys is, so, what's the normal dose with this stuff? Well, guess what? There is no normal. We make probably 1,000 different formulations, and we customize them to the individual because everybody's needs are different. We go through the training, we instruct them, we titrate their doses. Now, the great thing about working with Dr. Natale is, he'll refer somebody over, and once we kind of get through the workup on these guys, we know what's working for them. We know how effective it is, and we can send back kind of a very concise recommendation. Say, this guy's going to respond best to this formulation. I always look at these slides and these numbers because, one of the things that I always kind of key off on is the discontinuation rates. And I honestly think that the discontinuation rate is because there's not that effort put into making sure that the formulation is correct, that the dose is correct, that they've been properly instructed on how to do these administrations, how they've been coached in terms of just the process and how to avoid the side effects and how to avoid the dysfunctional parts of this. Once they understand it and you get them locked in, a lot of these guys will maintain on these medications for a very long time. And yeah, I can say that they typically get over the dislike of the injection pretty quick.
Yeah, I agree with that. And I especially, if you look what the average urologist does, and this is not to down my colleagues, but this is one of those uncomfortable conversations. The guy comes in and we talk about my prostate enlargement, and they go through things. Hey doc, by the way, and a lot of guys, here's a Viagra, or here's a Caverject, and just kind of leave it at that. Well, I'll tell you, for me, with my patients, if you're going to get an injection, the first time is in my office with Greg's drugs, by the way. So I wrote a prescription, got medication from him. It's in my office in a freezer. So I'm using what he's going to give you, my own particular volume and things that we're going to give you, and I test the medication. So then I call him and I'll send him a prescription, and we're communicating and say, listen, man, here's what I got. We may need to do this or that. Here's how the patient felt about it. I train the patient. Guess what? Even if I didn't do that, I know Greg would do it. So if you work that closely together, you get better results. I'm 100% convinced of it. So that's why our partnership works so well for our patients, is because we talk and communicate, and we prevent these problems for folks.
It's the collaboration.
Yeah. And that's why, then I can tell you, just as we collaborate with meds, I think Greg calls me and says, hey man, listen, I got to, and he's done this more than once. Got a patient that says, I'm trying these things, we did this and this and this. And even if they're not necessarily seeing me, it's like, hey, listen, this is a patient of mine I've had for years, and I think they need an implant. When Greg says, I think they need an implant, they're going to be in my office. That's what we're talking about. I'm not going to go undermine or say anything else. No, if we can't get the other medications to work and you're really in that point, this is what we're going to talk about. So I'll kind of weigh in on this part now, since this is where my expertise are. Just to kind of give you, for the guys on the phone or on the watching this, an idea of my background. Most urologists don't put penile implants in. The ones that do, the average will put in about 10 or 20 a year at most, and that's a good number. Usually less than 10 is the most average number. I average around about 100 implants a year because this is my passion. Men's health, sexual medicine is my passion, and this is what I have trained to do. This is where I come in. So the penile implant is an amazing tool. It's been around for almost 50 years, believe it or not. Really a story that's kind of parallels the Steve Jobs Apple story, where essentially a urologist in his garage with a couple of engineers put together a mechanical device, and over the years perfected it to what it is today, essentially. which is a 3-part device, which you'll see in a moment, that has worked on a hydraulic system. It, as best as it can, kind of gives us the most similar function to a normal penis as we can. That is, you can have it on demand. There's nothing to prepare. The device pumps. It stays as rigid as you need it for as long as you need it, and allows you to complete the active intercourse. Interestingly enough, over the course of the years, they've looked at how satisfied patients are with these devices, and satisfaction rates remain high because, in the end of the day, a lot of guys who get implants will tend to have had a history of going through some of the other therapies, and said, you know what, this is not working to my satisfaction. I want something else. And when they get to that, they're not restored to being 19 years old again, but what they are is given a more reliable, reproducible result. We have a little animation here, which I think is kind of cool to watch. This video here, and we'll let it run through, will show you the different components. I think I can, if you guys can still see my finger here that you can project on the screen, you'll notice in the most commonly implanted implant, there's 3 parts. There's a pump where you can see the model here is squeezing on the pump. That's drawing fluid from a reservoir that's filled with saline. That's draining the fluid into these cylinders, which are inserted in the erectile bodies that we talked about earlier. And then as the device is being deactivated, there's an off button that's held for about 4 to 5 seconds, and that'll allow the fluid to drain back in the reservoir itself. So that's the quick kind of summary on the implant. I will tell you there are, I'm going to kind of use a minute to plug my sponsors. There are 2 companies that produce implants in the United States. They're equal devices in terms of their appearance. They certainly achieve the same things. I have the tendency to defer to my Boston Scientific colleagues for their assistance with the implants, because it is I believe, a more solid product in terms of prevention of infections. They have a far bigger, and this is true, far bigger kind of catalog of options. So there are different types. There's malleable prostheses that are just firm and erect all the time. There's a 2-piece prosthesis that is essentially partially erect, but has a pump mechanism to it. And then, of course, within the category of what you just saw, there's 2 different types of 3-piece penile prosthesis, one of which is nicknamed the LGX, the length girth expansion device, that can actually help resuscitate length and girth in men who've lost it, particularly men who've had things like prostate cancer surgery. So I have a tendency to really bias to that implant. I think it's that company. I think they make a great product, and it does work well for my patients. So that's the reason why I work so closely with these folks. But most importantly are my patients I take care of when they need this treatment option. This is where I'm going to first is we're going to work with them with getting past their troubles with erectile dysfunction and get them fixed, to be honest with you. I think if you look, the first thing on the list here is the permanent solution, and that's the kind of nice thing. One of the things that separates implant surgery from the rest of what we saw is that implants are really essentially the cure, as best as we have it today. So I think that is one thing to keep in mind when you do progress along the ways with erectile dysfunction. I like the spontaneity, the durability of things as well. Question I get a lot is, do you see it? Can people tell? And the answer is, the only person who's going to tell is you and your spouse. That's about it. So you can see why that there's so many implants placed over the last many years, because eventually in men who really say, gosh, doc, either this doesn't work or I don't like it with their medication treatments, this is where we're going to next. The other question I get probably more commonly than what I just said is it covered? And the answer is yes. This is not an aesthetic implant like breast implants. These are not, they see it as a functional treatment. So yes, your insurance company for the most part should. Medicare certainly does. There are some private plans where they've had special exclusions, but we always make sure that we run your benefits. We would never get you in a position where you'd get in trouble with them. So That is the answer on that. The risks of surgery are there. You can read them yourself. To me, the advantage of a high volume surgeon is making sure that we know the nuances and work to prevent any of the troubles that could happen that can be that you see on the list here. And that's about it for me. Greg, I don't know if you have any last points. I do know that we've purposely saved time for the questions. We got a good 20-minute window.
I do have one quick point, because just to piggyback off what you're saying, since we've really started partnering not only with your offices but with Boston Scientific, it's a absolute fundamental for me when I get a patient who has essentially gone through the gamut of their treatment options. Just like yourself, my goal is to get these guys to where they're enjoying their life, it's quality of life. And I don't hesitate to refer patients to Boston. And the great thing is having a resource like that, where they are actually able to get a phone call and get all their questions answers. And if they need a referral, obviously I know where I'm going. But it is absolutely beneficial for my patients just to know that I've got that extra tool in my toolbox.
Yeah, I can't. I mean, in the end of the day, it's the people who are sitting through this presentation. Besides the fact we're both extremely handsome and obviously very entertaining, the reality is that people need information, and they know they can go on the internet and read it. But it's so much better when they do that and then talk to guys like us, that we partner, we educate, and when you have a company that you have available that does things like creates an entire website, unbranded, by the way, not shoving everything down your throat and saying, oh boy, all we want is penile implants. No, they have a website that says, here's educational material on each of these treatment options, and serves as a springboard for patients. That's pretty cool stuff. So I'll quit the rah stuff now for my colleagues. I appreciate, Greg, you sitting and us working together. I think we should start opening up for questions so we can start getting to the ones that you listen up.
Yeah, I would agree. We've got quite a few questions in the chat box. So if it's okay, I'll just punt a few of them over to